As we head towards World Malaria Day, concerns have been raised around the progress being made on the ground to eliminate the disease. The World Health Organization says infections in Africa account for over 90% of cases and deaths. To discuss the challenges and progress being made, I am now joined by Dr. Chris van Straten, who is a Global Health Advisor at International SOS. Dr. van Straten, a pleasure to have you on the program this afternoon. So, given the stagnation in the progress against malaria in recent years, what do you believe are the key factors contributing to this setback, particularly in vulnerable populations such as pregnant women, infants and children under 5?
Excellent. Thanks so much for inviting me on the show. Important topic. If you look at the numbers prior to 2020, so in other words 2019, we saw that the malaria cases in many parts of Africa and globally were either stable or improving. Less transmission, less deaths. Then due to the COVID pandemic, much of the funding, the severe lockdowns, a lot of that progress was put on the back foot. And we've seen malaria cases, especially from the 2022 data, showing over 249 million cases globally and over 600,000 deaths. And as you cited earlier in the call, over 90% of those cases and deaths happening in parts of Africa. Another key part of that, we believe, is climate change. If you have a shorter, warmer, wetter winter, that the Anopheles mosquito requires a warm, wet place to replicate. And if you look at the winters we've had, this last winter in the northern part of South Africa, we saw malaria transmission.
So when looking at the statistics, Africa continues to bear the heaviest burden of malaria, with rural populations facing significant challenges in really accessing healthcare services. What strategies do you think are most effective in really reaching these underserved communities, if you will?
Absolutely. So let's also go back to the basics. Prior to 2019, we were in many parts of rural Africa winning this fight, and we were winning with some basic tools. Step one, educate. An empowered man is a man with knowledge. So we need to get back to educating on a community level and empowering people. Another thing I can promise you from working in many townships and rural areas for much of my career, people who've lost family and friends to malaria are keen for any tools to fight malaria. So one, tools of education, mosquito nets, especially with insect-pregnated mosquito nets, the long clothing, impregnated clothing, repellents, and then different chemoprophylaxis regimens, whether it's seasonal, if there's a peak season in young children to prevent, and it is exciting, but we don't want to overstate our excitement, but these vaccines, RSS and the R21 vaccines that are being rolled out in many African countries, in that most vulnerable population, which is between 0 and 5 years of age, we're hoping that will really have an impact over time. But getting back to the basics and doing the basics well is really important.
I want us to crystallize this point. So World Malaria Day 2024 emphasizes the need to address health equity, gender equality and human rights in malaria responses. How can we then ensure that malaria control interventions are inclusive and really reach all affected populations, including refugees, migrants, internally displaced people as well, and indigenous people?
Yeah, now that's a very good question, also a very complex question. The answer is no individual Ministry of Health or company will be able to tackle this on their own. It really does require a multinational, multi-level approach, and it includes the high-level planning and support from the WHO, it's the African Union, it's African CDC and South Africa, and all these different countries, because even if we were to eliminate malaria in South Africa, which I think we certainly can, if we don't really make a big dent in Mozambique and in Angola, and we have different migrating workforces, it will come back into South Africa. So we can't just fix it in one country. We have to see all of us as being part of the solution and making sure that we really do support everyone, not just those who have the most resources.
With that said, it also then begs the question as to what are the primary challenges in really ensuring this equitable access to vaccines, particularly here on the African continent?
Absolutely. Good. Also a very good question, and one with many layers. As we saw with the COVID pandemic, during the production of those vaccines, they were only really being produced in the developed world and then being shipped down to parts of Africa. And I don't think that did us any favors. Since then, there have been big drives by our Ministry of Health and our government to make sure that we as South Africa and neighbors, and I'm thinking of West Africa and Nigeria, are going into partnerships to make sure that, one, we can build the facilities where we can manufacture our own vaccines, and with coalitions or partnerships with the WHO and the manufacturers getting licensing in some instances at almost no cost. So that is a significant step forward. And all the funding at the moment for the malaria vaccines is, you can't, I as a private individual can't get these vaccines at the moment because it's only as part of WHO programs in partnership with Gavi and the Ministry of Health on making sure that those vaccines go to where they're needed most. So it will be a combination of private, government and philanthropic partnership to make sure that that happens.
Let's discuss the shortfall in malaria vaccine doses and also the urgent need for action to really accelerate deployment. What role do you see international institutions like UNICEF, you've also mentioned Gavi, what roles do they play in really addressing this shortfall? And how can African nations then enhance their capacity for vaccine rollout?
Okay. So one, it's Gavi, and if you look at UNICEF and the role they've been playing a really key role in the administration and making sure that, for example, the cold chain aspects of this are complex. There was an article I was looking at recently that I wasn't aware of, but you can have this amazing vaccine, but if you can't do the cold chain effectively and have a fridge that is cost effective and even in extreme environments, or if there's no electricity to keep it running, but a fridge that can use solar, that's got long-standing capacity in it, then you can make those vaccines last longer or less likely to break down. So it's Gavi with that kind of funding. And what has also been really encouraging, and this goes from not just the government level, but I've been really encouraged by the people on the ground, the community saying, we want this vaccine. And the reason I'm pleased with that is if you think in the COVID pandemic how much there was a lot of skepticism. And I think intelligent skepticism is a good thing. But anti-vaccine sentiment has not done anyone any favors, and it has probably cost many lives. Whereas with the malaria vaccines, we're seeing the community going, we do not want to lose more children and breadwinners to this dreaded disease. How can we support and be part of it? And you're not going to win this battle unless the community at a grassroots level needs and wants this particular vaccine and is involved. And I think that's important. It's sometimes easy to go, well, we have the answer. Well, I'm sitting in Johannesburg and I'm a smart guy, but I don't have all the answers. And I think we make a mistake by not including the community.
With this in mind, but also building on the success of past malaria eradication efforts, what lessons do you think we can learn from history to really inform current, call it strategy for combating malaria in Africa?
First off, community and education and engagement. You cannot force a solution on a community. The community has to be involved and support these interventions. What we did see too before these vaccines came along, the vaccines are exciting, but they're not the silver bullet. They will not get us to where we want to be on their own. And we certainly need to make sure that we are vigilant. We need to understand that climate change is impacting the spread of malaria. And we need to continue to be monitoring, to be vigilant, and to grow these partnerships and coalitions so that we really can. That deadline of 2030, that's 7 years away. That's very close. And if you look at some of the setbacks we've had, that's a big ask. And I think it's going to make sure that we keep communicating like we're doing. Thank you so much for this particular interview. We need to amplify this message, whether through channels like this, on radio, in media, and make sure that all of us are contributing to making a success within our lifetime.
As we wrap up our conversation, but also given the complexities involved in vaccine distribution and also these regulatory approval processes, how can African countries then streamline the processes to expedite the rollout of malaria vaccines, but also save precious lives in addressing the malaria burden?
Yeah, challenging. And the expediting with the vaccines, remember during the COVID pandemic, there was it was pre-approval. In other words, it wasn't full authorization to use these vaccines. There was first stringent testing that was done, but a lot of money was put in to the development and testing to make it available to us earlier than we would normally expect. Doesn't mean corners were cut, but it was streamlined and made more efficient. With the malaria vaccines, what's fascinating, I'm thinking now back to my grandfather's generation. He was also a doctor. His colleagues were working on malaria vaccines. There have been over 100 that have been tried and failed. So this has been coming for decades. And to finally have 2 vaccines that have shown they're not the silver bullet, but they are effective. And so what's happening now is the expansion is happening, the data is being collated. Increasingly, we're seeing good numbers coming in. And the safety aspect, it's really important to make sure that vaccines are safe. They must, one, protect you from the infection, malaria, but they must also be safe in the short term and the long term. And that data that we're getting in is looking very positive. And the next steps are ramping up that infrastructure, including cold chain operations, the follow-up and administration of being able to keep track of who's been vaccinated, when do they get their next shot, and the data on is it being effective. So, there's a lot of elements to this. I'm enthusiastic and I'm optimistic, but hopefully not. One doesn't want to be blindly optimistic, but we need to keep moving forward. If we can win the World Cup by working together as a team, I hope we can score a try with malaria. Maybe not by 2030, but within our lifetime,
With this in mind, let's get your parting shot. What do you think are the key priorities and also the strategies that you've alluded to that you believe should be implemented to really accelerate the progress towards the WHO Global Malaria Strategy milestones, but ultimately achieve the vision of a malaria-free world?
Okay, good. So the first element of this is that overarching mission and vision, which the WHO, I think, has articulated extremely well, and our own Ministry of Health articulated really well in their recent release on the program for malaria and eradication of malaria in South Africa. And that is, it is possible to eradicate malaria from countries. In fact, over the past 4 or 5 years, several countries in parts of Asia have managed to be certified malaria-free. So can it be done? Yes, it definitely can be done. So one, have your clear vision. 2, using, sort of re-energizing the old strategies and refunding. The education and communication parts that we've spoken about, re-emphasize that, but engaging in the communities. We cannot succeed at this if we do not engage on a community level. And then with the development of these vaccines, it's costly. It takes huge resources. And there does, as you said earlier in the interview, there needs to be focus on Africa being able to produce and do the scientific research and development, the R&D that goes into the development and manufacture of these vaccines. So we must focus too on being more independent. And then there's another element that I normally talk about a lot, but we've skirted on climate change. I don't think I have the solution for climate change. I know I don't. But we know that it's already impacting many countries and impacting infectious diseases like malaria. And we need to therefore be vigilant, keep tracking and monitoring, and implementing those strategies that work prior to preventing malaria and its spread into other countries.
That wraps up our discussion with Dr. Chris van Straten. He's the Global Health Advisor at International SOS. Speaking on the critical topic of World Malaria Day 2024 and exactly what it means. Potso Silo is standing by to give you all the latest in the world of sports. Do stay with us.